Okay, 103 na. Let's go. Nak, bakit hindi ko ma-mute? Hello, we're on FB Live now. Welcome everyone. Thank you for joining us for today's webinar. The title for our webinar is Eat Right, Bite by Bite. For the Nutrition Month of July. My name is Rowena Ortiz, or sometimes they call me Weng. I'm one of the admin for Scleroderma Awareness Philippines. Let me also acknowledge Dr. Evan Vista, who shared this page in his profile. Today we are presenting two topics. The first topic is the power of mindful nutrition and healthy eating habits, a diet guide for scleroderma. And the second topic is the dietary tips for patients with GERD or gastroesophageal reflux disease. Before I get started, we just have to inform everybody for some reminders. Please mute yourself. We will only allow the speaker to speak during the webinar proper. Questions will be, you can type the questions on the question box or comment box, and then we will entertain them after the presentations. So now let's proceed. We will turn over our time to the first speaker, Miss Donna Leen Lorena Basongit. Miss Donna Leen graduated with a Bachelor of Science degree in Nutrition and Dietetics. She also has her professional education units from Benguet State University. And then she also graduated cum laude from her masterals in public health from St. Louis University in Baguio. She's now a private diet and nutrition counselor for Benguet Laboratories, and she's also the chief dietitian in St. Louis University Hospital of Sacred Heart in Baguio. So good afternoon, Doc. I give the floor to you.
Good afternoon po. Narinig po ba ako?
Okay po.
Okay. So I'm going to share my slides. So the title of my presentation is The Power of Mindful Nutrition and Eating, Healthy Eating Habits. So this is specifically for scleroderma. I just wanted to share something that we have in common. I was also diagnosed with an autoimmune disorder. Specifically po, Hinox-Schönlein purpura, or HSP, they call it HSP. And it started with bacterial infection inside my body, of course. Kaya sa tuwing nagkakaroon ako ng colds, ang first na manifestation would be rash or vasculitis. Nung pumunta lang ako doon sa dermatologist, doon ko lang nalaman na I have HSP. So yung mga veins dito sa skin ko, usually on my limbs, so sa mga arms and then sa paa, pumuputok yung mga veins. So imagine that is very painful. So that is one only of the symptoms nung HSP ko. But diet-related, one of the symptoms of many times, ang common na symptom ko every time na nagkakaroon ng attacks would be bloating. I think nararanasan nyo din yan, kayong mga may scleroderma. Aside from bloating, there's also hyperacidity and sometimes diarrhea or constipation. And most of the time, I felt so tired. So palagi akong inaantok, palagi akong pagod. Alright. Anyway, um, I will be presenting to you the diet guide for scleroderma. So basically, there are two effects of scleroderma in one person, nutritionally speaking. One is malnutrition. Second is nagkakaroon ng nutrient deficiencies. Malnutrition, in a sense that pwede tayong maging underweight dahil kulang yung kinakain natin, hindi sapat, or wala tayong ganang kumain because of the fear of bloating na baka pagkatapos kong kumain, sasakit yung tiyan ko. Those feelings. Second is specific nutrient deficiencies. So kung kulang yung kinakain natin, especially from fruits and vegetables and from protein sources, makukulang tayo ng vitamins and minerals, specifically vitamin A, vitamin E, vitamin D, which we need dito sa paglesen ng symptoms ng scleroderma. And so, there's one thing I need to tell you, that there's no such thing as scleroderma diet. Compared to like a diabetic diet, a hypertensive diet. Since tayong mayroong autoimmune disorder, magkakaiba tayo ng symptoms. Yung mga nararanasan natin, magkakaiba. So, ang gagawin natin ngayon, or we usually recommend as dietitian, is to have a balanced diet. So, ano ba ang balanced diet? Balanced diet is having a complete or an adequate source in a right amount, proper and right amount of foods from proteins, from carbohydrates, and from fats, particularly healthy fats. And paano natin maisisingit ang scleroderma? So while observing balanced diet, kailangan natin also i-add ang mga fruits, ang mga foods na makakatulong para mabawasan ang symptoms ng scleroderma, specifically inflammation. So with balanced diet, kailangan nating dagdagan ng antioxidants and anti-inflammatory foods. So yun ang particular and specific na diet para kay scleroderma. All right. So let's know more about scleroderma. How can we eat well while having scleroderma? And so the following that I'm going to show you are only general diet recommendations for a person with scleroderma. Later on, we'll deal with the symptoms, kung paano natin i-manage through diet and nutrition. So first is sa ating mga prutas. Number one tip is to choose deep colored fruits. Now, bakit deep colored? So we can say, piliin natin when we go to the market. We can choose yung mga highly pigmented. When we say highly pigmented, yung very rich in color, like yellow fruits. So ano ba yung mga yellow fruits natin? Of course, yan yung lemon. Ano pa? Sweet gold. Yun. So yung mga yellow, green fruits naman. Yung lime natin. What else? Honeydew siguro, but particularly yung mga deep colored. Another, mga orange na colored fruits natin. What else? Purple, like your cherries and grapes and blueberries, yung mga ganon. Now, when we say kasi na deep colored, pag ang isang pagkain ay deep colored, ang susunod dyan is they are high in antioxidants. Yan ang clue ninyo. Once na bibili kayo sa market, ang deep colored, high in antioxidants. So these antioxidants, they will help you to reduce inflammation inside your body. Now, next is to choose fresh and frozen fruits as much as possible. Bakit? Kasi yung mga processed na fruits, meron niyang mga additives, meron niyang mga preservatives. And those are one of the many things na iiwasan natin kung meron tayong inflammation. This I will tackle later on. Next is to eat one serving at a time. Bakit? In your diet, for one day, for example, you're only allowed like 3 to 4 servings of fruits only. Bakit? Dahan-dahanan natin ito since fruits contain sugars, which I will explain later, and fruits contain fiber. And sometimes fiber causes gastric distension and ano to, bloating, and also constipation na sometimes yun ang isang symptom ng scleroderma. Next is avoid fruits that may cause excessive gas and bloating and GI discomfort, which will be explained later. All right. So for vegetables naman, like fruits, you choose also yung deep colored fruit. So as you can see there, yung kamatis, deep colored yan na red dapat. Yung squash, yan. So deep color yung orange niya, and then yellow for corn, and then sugar beets for red, for purple, orange for carrots. Ganon tayo mamimili ng mga vegetables para sa atin. And just like fruits again, choose fresh and frozen. Since pag processed kasi, mas maraming preservatives, mas maraming additives. Alright, next is sa proteins. So palagi nating sinasabi yan, choose lean cuts. Yung mga chicken and pork na may visible na strip of fat, palagi nating tanggalin yon. So for poultry, for chicken, tanggalin naman natin yung skin. So when choosing fish naman, always choose the fatty fish. Bakit? Kasi richer sila sa omega-3, which you need as part of your antioxidants. For anti-inflammatory factors also. Choose fish like tuna, salmon, mackerel, yung mga yan. And sometimes white fish also contain omega-3 fatty acids. Number 4 is to eat dried beans, yung mga munggo natin, kidney beans, white beans, and other legumes and pulses. It should be eaten as tolerated. Since kung napapansin natin, kung kumain tayo ng masyadong maraming beans, parang mabigat sa tiyan or very gassy ang feeling. So, yun ang iiwasan natin. So, eat dried beans as tolerated para maiwasan natin ang gastric distress. Alright. Next is, yan. For dairy products naman, palagi nating iniiwasan yan kapag bloating, there's a feeling of bloating. One reason is yung lactose nga natin. And if ever naman na hindi sumasakit yung tiyan natin when we drink milk or dairy products, we try to choose low fat and fat-free varieties. It is healthier, and it is parang mas maganda siyang alternative for your balanced diet. Another, if it causes distress, tanggalin na lang natin sa diet natin. Kung uminom tayo ng ng gatas, and kumain tayo ng yogurt, ng cheese, or any dairy products, kung palagi na lang na sumasakit yung tiyan natin and may mga symptoms na, tanggalin natin sa diet natin. Okay. For carbohydrate-rich foods like of course, your grains and carbohydrate substitutes, choose minimally processed products. So, anong ibig sabihin nito? Tingnan natin yung mga binibili nating breads, yung hindi refined. So, as much as possible, choose the whole wheat breads, yung mga brown breads natin. When we buy grains, we choose whole grains like quinoa, like rice, brown rice, red rice, black rice, and the ordinary white rice, it can be, as long as they are not highly processed. When we buy oats, mas maganda pag i-choose natin yung rolled oats or steel cut oats na sinasabi natin. Iwasan natin muna yung mga quick cooking or instant cooking because since they are lower in fiber, we don't need that. Kailangan natin yung higher in fiber. Which leads me to the second pointer na when you see a label behind for example, yung oats, titingnan natin doon sa label sa likod. Try to check if yung fiber na content is at least 3 grams per serving. Kung 3 grams per serving yan, you're getting the right amount of fiber within a day. So, try po nating tingnan yan. Once na pumunta tayo sa grocery, that's one of your assignments. Try to check and read the labels. Now, if you have GI distress or symptoms, avoid gluten-containing products like wheat, what they usually use in breads and pastries, rye, and barley. So, yung mga drinks natin, mga alcoholic drinks natin made out of rye and barley, try to avoid those kung may mga gastric symptoms tayo. Okay. For fats and oils naman, choose healthy oils. So, palagi natin sinasabi, virgin olive oil, yung mga yan, peanut oil, coconut oils, choose them more often. Ano pa, yung mga nuts natin, yung mga fats na galing sa nuts like peanut butter and almond butter, they're also rich in antioxidants but use them sparingly. Paminsan-minsan lang yung paggamit natin sa kanila. And use them within your recommended amount. So kung ako, na dietitian, ni-recommend sa inyo na in one day you only can consume like 6 servings of fats and oils per day, doon lang tayo. So, doon sa 6 servings. So beyond that, that wouldn't be a balanced diet anymore. Alright. Third is to limit solid fats. So ano ba yung mga solid fats natin? Ito yung ginagamit natin sa pagprito. Usually doon sa mga street vendors, yung ginagamit nila sa fishball kasi hindi naman sila gumagamit ng olive oil doon. Actually, they use lard, yung mga mga mantikilya like your butter and shortening, what they use in breads, yun ang iiwasan natin. So it's better if you cook your own food para alam mo kung ano yung gagamitin mong mga mantika, ano yung gagamitin mong seasonings, etc. Alright, some studies have shown that for Scleroderma, it's better to use yung mga oil na nakalagay dyan, olive oil, peanut oil, avocado, and coconut oils more often. And minimize the use of sunflower oils, safflower, corn oil, other types of vegetable oils, and soybean oil. So yun yung mga iiwasan. Kasi they cause gastric distress also because they're from nuts and then from beans and from seeds. So, all right. So, may fake news po dyan since ang Scleroderma is like there is an excess collagen doon sa katawan natin. So yung collagen na yon, pag masyadong marami, it forms into thick liner doon sa skin siguro and some internal organs. Now, I have to break the news na kapag kakain ka ng collagen containing na food item, especially yung mga bulalo na yan. Some may say kasi na pag kumain ka niyan, mas lalala yung Scleroderma kasi collagen containing yung pagkain na yan. But there are no specific evidences na magsasabi na tama itong parang anecdotal na experience na ito. So for me, it's still okay. However, if you have comorbidities like hypertension and other heart disease, kailangan nating iwasan yan. So if only concern natin it would be Scleroderma, you can eat bulalo and other collagen-containing food products and as well as broth once in a while para masatisfy ang cravings. Alright. So mabait naman akong dietitian, hindi ko nililimit lahat as long as may gana ang pasyente. Yun kasi ang importante. Kung walang gana ang pasyente, hindi mangyayari yung diet na gusto mo para sa kanya. Kung pipilitin mong tanggalin lahat ng mga magaganda dun sa diet, mas mahirap i-control yung pasyente pag ganon. Alright. So let us be more specific. So, nasabi ko kanina itong mga minention ko for carbohydrates, for proteins, and then for fats are general guidelines lamang. So, what if one person is hindi siya nakakaranas ng heartburn, hindi siya nakakaranas ng gastric distress, pero ikaw nakakaranas ka lang ng constipation, nakakaranas ka lang ng fatigue or palagi kang pagod, palagi kang groggy, anong gagawin natin? So, inisa-isa ko yung mga symptoms so that we can see how can we manage those symptoms with diet and nutrition. Alright. Yeah. So first thing, no, every time na ako kung may signs ako ng HSP, first na nararanasan ko is reflux. So bumabalik yung mga nakakain ko. And one reason or I think one management, na we can do when we have reflux is first is to have small frequent meals. Small frequent meals para hindi mapuno yung tiyan. Okay? Na one time na napupuno. For example, kumain ka ng breakfast. Ang kinain mo, 2 cups of rice, tapos 2 itlog, tapos 2 boneless na bangus, at saka 10 grapes, at may gatas ka pa sa gilid. So, that heavy meal for breakfast is too much for the stomach na i-handle. So, what's the effect of that? Mayroon nagkakaroon ng reflux na parang hindi na kaya ng tiyan. So, my recommendation is small frequent meals lang, usually 6 meals in one day na small lang. Of course, doon naman sa breakfast, lunch, and supper, you may eat rice, pero yung in between, you could eat like snacks lang siguro, light snacks, and then light meals. That's how we control it. And also, avoid eating 2 to 3 hours. Kung ang sleeping time mo is 10 p.m., your last meal maybe should be at 6 or 7 p.m. Para may oras pang ma-digest yung pagkain, para pag natulog ka, hindi aakyat yung kinain mo. Third is to avoid gastric irritants. So, usually yung mga doctors sa hospital, yun ang binabawal sa mga pasyente nila. So, yun ang nilalagay doon sa listahan. So, avoid gastric irritants. Ito yung mga irritants. So, iiwasan yung mga nag-i-irritate sa tiyan. These are citrus fruits, yung mga maaasim na prutas like dalandan, kalamansi, lemon, yung mga yan. Also, tomato products, especially yung mga hindi pa ripe na tomatoes. Greasy foods also, yung mga mamantikang pagkain, yung mga mga fried na foods. Yan. May mga nagkukos yan ng gastric distress. What else? Coffee also. Garlic, some spices like garlic, onions, yung mga yan, pepper also, and as well as carbonated beverages, your sodas, and also alcohol. Next is I recommend you to lose weight, especially dito sa may bandang belly area. Yan usually yung mga malalaki sa atin, especially sa mga babae, dun sa may belly area. Yan. Kung matatanggal yung extra weight, it will help na ma-lessen yung reflux or heartburn sa ating katawan. Alright. Paano naman pag may inflammation or parating parang sumasakit yung mga muscles natin. Ano ang pwedeng management natin para dyan? First is to increase intake of antioxidants. Antioxidants, yung nasabi ko kanina, usually you find them in deep colored fruits and vegetables, as well as from fatty fish, from flaxseed, from walnuts, some types of nuts, and also vitamin E, which you can find in olive oils and some seeds. So these foods can reduce the inflammation sa katawan natin. Another, yan yung palagi kong nararanasan noon pag may attacks ako ng HSP, fatigue. Parating kagigising mo pa lang after 2 hours, parang inaantok ka na, groggy ka na. Lalo na pag nag-work ka, masyadong mahirap ito. So what can we do? First is to have small frequent meals. Bakit? Pag small frequent meals kasi, na efficient yung paggamit ng nutrients sa katawan. So, kung paunti-unti yan, especially the calories, kung paunti-unti pinapasok sa katawan natin, nagagamit muna yung first na nilagay natin sa katawan natin before yung next. So, per batch yan. So, meaning, hindi ka mauubusan ng energy for the rest of the day. Second is to increase fluid intake. So aside from keeping you hydrated, it will make you feel less groggy. Kasi kapag dehydrated ka, parang feeling mo, ano to, parang dry ang feeling na parang kang inaantok, especially dito sa may eyes. Yan. Next is to exercise. Ang sinasabi nila, pag mag-exercise ka, lalo kang aantukin. Pero hindi po. Pag mag-exercise ka, parang kang inaantok lang on the first try. But as you go on, parang na-energize ka. Meaning, nagagamit yung energy doon sa katawan mo. So, we allow physical activity from between 30 to 60 minutes of moderate intensity na physical exercise, such as walking, biking, yoga, yung mga yan. Especially pag working tayo, once in a while, we stand up from our seats and then we walk. Yan, wag palaging nakaupo kasi mas lalo tayong hihilain ng upuan. Alright, fourth is of course, to sleep 7 to 8 hours every night. Para naman on the next day, we have full recovery kung ano man ang nangyari the day before. Okay. Yan. So, sino sa inyo ang may ganito? Yung Raynaud phenomenon, ito yung parang matitigas na part, di ba? Sa fingers usually. So, this is caused by improper circulation. So, improper circulation, ano ang dapat natin gawin? Yan. First is to exercise ulit. So, it will promote proper circulation. And then it will increase yung blood flow from your lungs. Every time you exercise, it will increase oxygenated blood doon sa ating mga veins, papunta dyan sa fingers natin. Kaya kailangan nating mag-exercise para malesen yung incidence ng Raynaud phenomenon. Aside from that, eat foods rich in zinc and iron. So, if you have finger ulcers na parang, nagsusugat-sugat na yung mga fingers natin, eat foods that are rich in zinc and iron. Iron is found in your animal proteins, especially red meats like pork and beef. It will promote wound healing. So, kung kakain tayo ng ganyan, of course, hindi naman magic na pagkakain tayo ng pork and beef, mag-heal agad. So, as much as possible, like in a week, like 3 to 4 servings or 3 to 4 times tayong kakain ng red meat. Third is to increase animal protein, yun nga, for iron para sa atin. Alright. Yan. So, alam nyo kung kaninong skin yan? Skin ng elepante. Minsan, isa yan sa mga symptoms ng may scleroderma. So, aside from increasing the water intake, And pag hindi effective yung lotion natin na nilalagay, moisturizers, vitamin E, rich foods like your nuts, avocado, olive oil, and peanut oils, they might help to reduce yung pagda-dry and pagta-tighten ng skin. So, dapat yan, hindi natin tinotolerate. Kailangang alagaan natin yung skin natin. Alright. Ito yung majorly na nararanasan ng mga may autoimmune, yung bloating, distress, constipation, or diarrhea. Yan. So overall, we call that gastrointestinal symptoms. Ano yung nararanasan nila? Usually constipation. So yung mga patients na pumupunta sa akin, usually bloating and constipation ang common na sinasabi nila when it comes to food allergies, food intolerances, and autoimmune disorders. So, first thing na pwede natin gawin is to consider eliminating gluten from your, nasabi ko kanina, gluten from wheat, from rye, and barley, and also lactose-containing foods like milk and yogurt. Now, if nothing happens after na natanggal natin yung gluten and the dairy products sa diet natin, we can switch to low FODMAP diet. Na I don't know if narinig nyo na yung FODMAP, which I will discuss kasi mas kailangan ninyo to as your guide. Okay. So ito ang low FODMAP diet. FODMAP is, FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, isa-isahin natin. So fermentable, alam naman natin 'yan. Pag na-ferment ang isang bagay, nagpo-produce 'yan ng gas. So yun ang ayaw natin because when there is gas inside our stomach, nagkakaroon ng bloating and gassy feeling. So yun ang iwasan natin. Oligosaccharides, these are from fructans and galactans. Disaccharides, most specifically lactose, yan ang iwasan natin. Monosaccharides, excess fructose from, of course, fruits. And then polyols, which are your sugar alcohols. Now, of course, hindi natin memorize yan lahat. So, this is what we'll do. Yan. Okay. So, FODMAP is basically sugars and carbohydrates. Okay. Sugars and carbohydrates. Nakita nyo kanina, meron yung term na masyadong common sa kanila, saccharides. So saccharides, these are the building blocks of carbohydrates. And bakit natin i-avoid yun? Because they cause gastric problems. I'm sorry for the dogs, masyado sila maingay. They are poorly digested in the gut. Yan. And they are easily fermented. Itong mga certain saccharides na sasabihin ko mamaya. So for us to understand it better, we should know more about the diet. Yan. Okay. Oh, nasabi ko na kanina. So saccharides, these are a group of sugars, starches, and cellulose. Yan. So I think hindi ko madidiscuss yan lahat kasi kukunin niya, kakainin niya yung time natin. So, I might as well magbibigay na lang ako ng examples of those para mas maintindihan natin. Okay. So, these are the types of oligosaccharides. Yan. So, ano ang dapat na iiwasan nating oligosaccharides? First are breads, pastas, and drinks that contain, sabi ko na naman kanina, wheat, rye, and barley. Second is, huwag kayong matatakot dyan sa, sa banana. Okay? So, yung mga overripe bananas, yan lang yung mga iiwasan natin. Citrus fruits like grapefruits, yan. Nectarines, also plums, peaches, and persimmon, yan yung mga iiwasan natin. What else? nuts like cashews and pistachios. I'm so sorry kung masarap para sa inyo ang kasoy at saka pistachios, masarap yan papakin kahit 1 kilo siguro mauubos natin. But sometimes, yeah, it may cause gastric distress and then bloating. So, kailangan nating unti-untihin yan na tanggalin sa diet natin. Alright, another is yan. Sa lower left, makikita nyo mga garlic, yan, onion, ano pa, asparagus, onion leeks, and then shallots. Yan, they will cause gastric distress. Also, black beans, kidneys, ano pa, soya milk, soybeans, and other soybean products. What else? Additives. Yan, yung mga nilalagay nila doon sa yogurt, sa ice cream, sa chocolates. Okay? So, yan yung mga additives na ayaw natin. Specifically, inulin. I-N-U-L-I-N. Inulin. So, tignan natin doon sa likod ng ingredients list ng mga pagkain na binibili natin. It should not have the word inulin in it. Okay? So, rule of thumb. The shorter the ingredients list para sa atin, the better. Kung meron tayong makitang mga chemical na names doon sa ingredients list, iwasan muna natin. Okay? Especially kung hindi tayo sure kung ano iyon. Alright. The shorter the ingredients list, the better. Alright, tandaan natin. Okay, another. FOD, so disaccharides na tayo. Of course, ang disaccharides, marami kasi yan. So, we have 3 disaccharides na types of sugars natin. One is sucrose, one is lactose, and one is maltose. So, among those 3 disaccharides, ang iiwasan natin is lactose. Kasi yun ang nagkakos ng bloating sa tiyan natin. So, mga milk galing sa cow, sa sheep, sa goat, yun ang iiwasan. And as well as yung standard or regular na yogurt, yan, yung pudding, ano pa, yung ice cream natin. When I say regular, yan yung mga regular formulation. So, piliin natin yung lactose-free milk, lactose-free ice cream. Yan. Okay, some cheeses also contain lactose, like soft cheeses, ricotta, and then cottage cheese. So kung magpipizza tayo, tingnan natin yung toppings, wala siyang ricotta or cottage. Yan lang naman yung dalawang cheese na usually nagkakos ng gastric distress. Alright, next is milk chocolate. Kasi of course, may milk. Okay, so kung gusto natin ng chocolate, we choose dark chocolate because it also contains naman antioxidant. Pero hindi porke sinabi natin na pwede ang dark chocolate, pwede na natin kainin ilang bars ng chocolate, okay? We have a limit. For example, yan, nakikita nyo dyan sa lower right corner. Isang block lang na ganyan ang pwede sa atin. Sorry. So, kung gusto natin ng dark chocolate, better 1 block just to satisfy the craving. Okay? Especially kung may mga comorbidities tayo. Alright. Next is monosaccharide. So, monosaccharide, this naman are single. Single chain lang siya. Ang disaccharide kanina, hindi ko nasabi, sorry. Ang disaccharide kanina, double. So, 2 monosaccharide yon. So, ang oligosaccharide naman, yung first na na-discuss kanina, from 3 to 10 na monosaccharides yan, magkadikit-dikit. Ang monosaccharide, there are 3 types of monosaccharide. First is glucose, your blood sugar, na narinig nyo na siguro to for diabetics, your glucose, and then your galactose, and then your fructose. Ngayon, ang iwasan natin na monosaccharide is fructose. Okay? So, kanina ang iwasan natin na disaccharide is lactose. Ngayon naman, ang iwasan natin monosaccharide is lactose. Fructose. Okay? Fructose, it comes from fruits and some specific na vegetables. Alright. So, there are specific fruits na excess or masyadong marami yung fructose in 1 serving. And among those are apples, and then mango, and then pears, yan, watermelon, cherries, yung mga figs, and also apple juice. Kung mag-apple juice tayo, Small amount, small serving lang. And then some vegetables like snap seed, asparagus. And then, yan na naman yung nasa gilid, lower right corner. Pag makikita natin, may sweetener dyan. Usually, nilalagay ito sa mga candies and then sa mga ice creams. Yan, makikita natin sa label. High fructose corn syrup. Yun ang iiwasan natin. Lahat ng mga may corn syrup doon sa label, iwasan natin. And then, aside from that, also honey and agave. Yan. Yan yung mga sweeteners na iiwasan natin. Aside from that, I will also discuss another type of sweetener on my next slide. The last one doon sa category ng FODMAP are your polyols. Your polyols are sugar alcohols. Yan. Sugar alcohols, narinig nyo na ba? I think narinig nyo na yung xylitol, yung gum. Yon. That is an example of polyol. So aside from that, polyols are also naturally present in some foods like prunes, like cherries, yan, cauliflower, mushroom, sweet potato. Tapos in excess of squash, pwede rin magkakaroon siya ng excess na polyol na content. And also ang gums and candies, yung sinabi ko kanina, yan, extreme talaga nilalagay nila dyan na sugar alcohols like mannitol, xylitol, yan, yung mga yan. And then, dun sa lower right corner again, makikita natin, ano yan? Carbonated drinks. So, mga soda natin, especially mga diet soda. Yung mga sugar-free na sinasabi nila na claims nila doon sa mga label. Actually, they are sugar-free. They are free of brown sugar. They are free of table sugar. But they are not free of sugar alcohols, like your polyols. Okay? Sometimes they use xylitol, mannitol, and other types of artificial sweeteners like acesulfame K, yung mga potassium-based na mga sugar substitutes. Alright, so that is your FODMAP diet. Okay, so this is my disclaimer. Since nai-open up ko yung FODMAP sa inyo, we suggest a one-on-one consultation with a dietitian. Since itong FODMAP na ito, nakakuan kasi siya, may basis siya kung paano namin ini-start yan from the challenging period and then from the removing period. So may mga pagkain kaming tinatanggal and then pinapasok ulit so that we'll know kung ano ba talaga ang sensitive sa tiyan ninyo. So we call that challenging. So that lasts for around 3 weeks to 3 months, depende yan sa dami ng pagkain na sensitive kayo. Okay, so that is my disclaimer. Hindi ko sinasabing yung mga pagkain na yun ay totally iwasan natin, but especially pag iniwasan kasi natin yun, we may pwede tayong magkaroon ng nutrient deficiencies, especially vitamin C and then vitamin E, since tatanggalin natin yung ibang citrus fruits and nuts sa diet natin. So always consult a dietitian. All right. So what are my pieces of advice generally? Yon. So ending na, I'm towards the end of my presentation already. So first is to have small frequent feedings. So sa paglamon daw natin, we should chew our food 10 to 15 times muna bago natin lunukin. Yan, kahit wala tayong oras para i-chew ng 10 to 15, it's better because psychological yan, kasi hindi ka nagmamadaling kumain. Pag hindi ka nagmamadaling kumain, hindi mabibigla yung tiyan mo. Alright? And then they also say na every 3 to 4 hours, yan yung the best time for you. Small frequent feeding. So sabi ko kanina, small lang, wag in bulk. So breakfast, small lang, light breakfast, and then you may have lunch, light din, AM snack, and then PM snack, and then light supper. Okay? Huwag palaging heavy ang supper natin. Usually sa ating kasing mga Pinoy, pag in-invite na event, palaging dinner, di ba? So meaning pag dinner yan, heavy talaga. Samgyupsal dito, samgyupsal doon, buffet dito, buffet doon. So yun sana ang iiwasan natin. If we wanted to eat more, it's better to eat more during breakfast and then lunch para at least magamit natin the rest of the calories for the entire day. Kasi pag dinner, ang alam na kasi ng katawan natin is matutulog na, magre-rest na, pero bakit ang dami pa ng pang pagkain sa katawan? Parang ganoon. So malilito yung yung tiyan ninyo. Alright? Okay. Also, by the way, suggested na meal time natin is 7 a.m. for breakfast, and then 10 a.m. AM snack, and then 12 noon, and then 3 p.m. for PM snack, and 7 p.m. And if you want late night snack, pwede naman. But 2 to 3 hours before bedtime sana ang last meal natin. Alright. Second is to choose fresh and whole foods. So alam naman natin, dapat fruits and vegetables are the original fast food. Kasi apple, hugasan mo lang yan ng maigi, kainin mo, di ba? That's too fast. So why not ibalik natin yung original na mindset natin na yan talaga ang fast food. Not the typical fast food that we have today na mga burgers na and fries na fast na talaga because drive-thru pa lang meron na tayo. Why not switch to fruits na lang and some vegetables na pwede natin kainin raw. Okay? Third is to increase our antioxidant um, rich foods doon sa diet natin, and also anti-inflammatory foods. So, nasabi ko kanina yung mga yan. And also to emphasize yung nasa picture dyan. So, among those anti-inflammatory foods are your spices like cinnamon, turmeric, and then cumin, peppers, yung capsaicin kasi doon sa pepper, it is also anti-inflammatory, but it may cause gastric distress. So, kailangan nating i-weigh yun. Kung sensitive kayo, so we have to remove. We'll get more of the anti-inflammatory effects from other foods. Ganon. Okay. So fourth is to avoid added sugar. So nasabi ko kanina, yung inulin, and then as your food additives, and then added sugars like your xylitol, mannitol, sorbitol, yung mga yan ang iwasan natin. So palaging sinasabi ng isang dietitian, always check the label. Check the label, mommy, sabi nga niya dun sa sa commercial. So yun palagi ang titingnan natin. Always check the label. Alright. Fifth is to consider taking multivitamins and mineral supplements, especially vitamin C, A, E, and D. Pero ang disclaimer lang natin dyan is always consult a doctor if you need vitamin and mineral supplementation. Kasi this may cause toxicity also in the body. May toxicity kasi ang mga vitamins and minerals, so we always have to consult our doctors. All right? So I think that ends my report. It's a very short, I don't know if short ba yun? It's a very short presentation only. Kasi kaming mga dietitian, we always base the needs of the patient in an individual approach. So may kanya-kanya kayong mga kailangan, may kanya-kanya kayong mga needs. So sa ganitong way, I cannot disclose everything kasi depende yan sa tao. Depende sa needs niya. Alright, so I am shamelessly promoting my page. Here you can see, sorry Ma'am Weng, Miss Donna's True to Life Nutrition. Yan yung page ko. So I give some advice there and some services that I offer. here in Baguio, I am so sorry, dito kasi ako sa Baguio nakabase, disease-specific diet counseling, weight management coaching, menu planning, and yung tube feed formulation for patients na naka NGT and naka-PEG, we do that also. Pero I do online consultation but not in a way na masyado kaming masyadong may interaction kasi of course long distance. So those are my contact details on the right. All right. So thank you very much for listening to my presentation. I hope you've learned and some added information to your readings also.
Yes, thank you, Ma'am Donna, for the very nice presentation. If we have questions, we will entertain them after the second presentation, Ma'am Donna. So let's proceed to the second speaker. Our second speaker for today is Dr. Anthea Tan. She graduated with a bachelor's degree in pharmacy from the University of Santo Tomas. And then she proceeded for her Doctor of Medicine degree from the same university. Currently, Dr. Anthea Tan is a senior fellow in the section of rheumatology in St. Luke's Medical Center in Quezon City. So without much further ado, let's welcome Dr. Anthea Tan.
Hello. Hi. Hello.
Hello, Doc. Good afternoon.
Ito. Kita po ba yung slides? Teka, ito. Kita po ba siya?
Wala pa, Doc.
Wala. Ayaw. Wait lang. Ayan. Wala pa din.
Yan na, Doc. Okay na.
Okay. So, good afternoon po. Parang nasabi na lahat kanina. Siguro, I'll just make this short to siguro emphasize. So, my topic is dietary tips for patients with GERD. Alam naman po natin with Scleroderma, a lot of patients with Scleroderma are also suffering with yung reflux na tinatawag or yung GERD, no? So, this is just to emphasize yung mga sinabi din po kanina. So, what's GERD? It's pinakasikat na gastroesophageal reflux disease. It's the backflow of stomach contents into the esophagus. So, yung mga kinain natin, bumabalik. Ito, normally, dapat pag lunok natin ng food or pagkain natin ng food, magko-close siya. But with GERD, hindi siya nagko-close ng maigi, kaya bumabalik po yung mga food natin. And yung gaano kagrabe yung condition na to, it depends sa diet and lifestyle natin. So yun nga, so ang mga most common symptom ng GERD ay yung ating heartburn. Meron din yung sour taste or yung parang minsan yung sa iba mapait daw na umaakyat. Yun yung regurgitation, yung nafe-feel nyo yung umaakyat yung food. Dumidighay kayo or bloated or parang hirap kayo lumunok kasi parang may nakabara. So, we diagnose GERD by yung typical signs and symptoms, yung mga nasabi ko kanina. Meron din tayong mga procedures, yung mga endoscopy, gastroscopy na ginagawa ng ating gastroenterologist. Meron din yung mini-measure niya yung pressure dun sa mismong sphincter natin. And mini-measure din yung mga pH. So, ito yung isang summary of diet and behavior that were said or nakakadagdag dun sa mga symptoms. As kanina sinabi, yung mga high in fats, caffeinated beverages, alcohol, and yung ating behavior. smoking, and obesity. So ano ba ang mga treatment sa GERD? So number 1, syempre yung ating diet and lifestyle modifications together with our drug therapies and surgery if sobrang severe. So treatment, ito yung mga common na pine-prescribe ng doctors sa inyo, no? We have yung dati, yung H2 blockers, yung mga famotidine, ranitidine, mga Zantac, no? Meron din yung mga antacids, yung mga nabibiling Maalox, or yung dati yung Tums, Alka-Seltzer. Ngayon, ang usual na pine-prescribe na yung proton pump inhibitors, yung mga omeprazole, esomeprazole, pantoprazole, mga Prevacid. And meron din tayo yung parang foaming agents, yung, hindi mo sabi nila, lasang toothpaste, yung Gaviscon, para for quick relief. So ano ba yung mga lifestyle modifications na kailangan natin gawin? So maintain an upright posture during meals and usually mga 45 to 60 minutes after meals. So ibig sabihin, habang kumakain tayo, hindi pwede yung nakahiga or nakaupo nga pero parang naka-slouch naman. So dapat talaga upright. Para rin ma-prevent natin yung pagbabalik ng food from the stomach paakyat. And achieve natin lagi yung ating ideal body weight, no? So sa mga medyo mabigat, advice talaga mag-lose ng weight. Kasi pag mas malaki syempre, di ba, yung sa may tiyan na area, mas napupush kasi yung food paakyat, pabalik. And pag natutulog, we also elevate the head, mga 4 to 6 inches. So mga isang unan, gano'n. Sa mga po nag-smoke, stop smoking. Ayun nga, avoid then to eat within 2 to 3 hours of bedtime. So dapat, kung magmi-midnight snack kayo, wag yung bago kayo matulog. And avoid clothing. Yung mga suot po natin, mga damit natin, wag po yung mga sobrang masisikip kasi nakaka-push din po yun sa may tiyan and babalik na naman yung food. So magre-reflux. And then we also have best sleeping. Yung left lateral is yung sa left side nyo. So yun yung pinakamaganda kasi yung tiyan hindi naiipit. For dietary management, halos nasabi naman na ni kanina po. So, ano lang natin, parang summarize. So, limit, hindi naman pwede talaga sigurong wala. Hindi naman po kami ganun ka-strict, no? So, limit talaga yung mga high-fat diet, or high-fat foods. Yun yung mga fried foods, yung mga fast foods, yung mga mahilig dyan sa fast food, iwas po. Yan, yung mga pizza na sobrang daming cheese, high-fat na baked goods, yung mga sweets, maraming cream or ice cream, meron din yung high-fat cheeses, mga sausages, mga processed foods, sausages, bacon, chichirya, mga potato chips. Yan, matataas din po yan sa fats. Yan nga po, avoid natin yung mga chili powder, pepper, mga maaanghang. Try natin i-limit din yung mga chocolate or caffeinated na pagkain and drink. So, yung coffee and chocolate. So, try talagang limit. Siyempre, yung iba hindi talaga po kayang wala. So, maybe 1 cup of coffee a day. Yun na. The next, of course, limit or totally avoid yung alcohol. Kahit anong klaseng alcohol. May it be beer, wine, mga gin. Okay? Avoid din yung mga mint, citrus foods, mga tomatoes, or yun nga, yung mga carbonated beverages. So, yung soft drinks, yung mga energy drinks, diba? Matataas po kasi yan sa caffeine, no? Yung mga Cobra, mga ibang energy drinks din. So, try po natin na wag nang uminom nun. And sa food naman natin, ensure na yung mga protein intake from low cholesterol. So, sample, mga salmon, almonds, mga lean. So, chicken breast, mga munggo, pwede po yan. So, ito naman po yung ibang food din na nakaka-help to prevent yung mga acid reflux nga. So, number 1 is yung mga high fiber foods para po mabilis siyang ma-digest. Hindi siya magtatagal sa tiyan nyo, and eventually, may chance na bumalik or mag-reflux. We also give you whole grains, mga oatmeal, brown rice, pwede naman yung white rice. For root vegetables, yun yung mga kamote, carrots, di ba? Yung beets. For green vegetables, pwede tayong yung mga munggo, green beans, sitaw, mga asparagus, broccoli din. So, ito yung mga ibang food na okay. So, yun yung celery, cucumber, lettuce, watermelon. Bakit sila okay? Kasi rich in water sila. So, mabilis siyang madadigest. Yun din yung broth-based soup. Yun yung mga nag-boil na soup for either beef or chicken. Yung herbal tea, hindi yan yung mga nabibiling tea na yung mga nabibili sa commercial. Yung herbal tea na yan yung mga ginger tea, yung mga natural. And then we also, pwede ka naman kumain niya, yung mga bananas, melons, mga nuts. So, mga yun pwede. And then, in summary, para mabilis. So, these are the tips. So, number 1 nga, quit smoking. Talaga. Mag-exercise po regularly para hindi tayo mag-gain ng weight or hindi tayo maging overweight. And yun nga, yung remain upright pag kumakain or pagkatapos kumain, mas maganda pong nakaupo muna. And then, yun nga, yung small frequent meals throughout the day. So, hindi pwede nga yung isang biglaan na, okay, pagkakain ka ng lunch, sobrang dami. Bawal po yun. Kailangan pa konti-konti lang. And then, yun nga, chew food slowly, as nasabi na rin po kanina. Sandali lang siya. And then, avoid yung mga triggers. Yun nga po yung mga alcohol, mga sobrang anghang, citrus foods, caffeinated na drinks. And yun, suot po tayo ng mga loose and comfortable. Hindi naman yung sobrang luwag, pero wag po yung sobrang sikip talaga. Kasi it could, yung tiyan natin mapipress. So may chance din pong mag-regurgitate yung mga pagkain. And yun nga, sleep kayo na yun, 4 to 6 inches elevated. Bawal po talaga yung flat na flat. And then yun na, minimize again caffeine and yung alcohol. And yun nga po, avoid lying down for 2 to 3 hours after nyo kumain. Para po ma-ensure na na-digest na yung pagkain, yung sa tiyan nyo, madadigest na siya. So, para hindi na po tayo mag-reflux. So, yun lang po. Baka may tanong po kayo, open for questions.
Thank you, Dr. Anthea, for your presentation. Sa Facebook Live, pero nasagot mo na to, Doc. May question dito kanina. Kung ang coffee po ba pwede?
Pwede. Wala naman talagang bawal, no? I think ang pinaka-secret is moderation talaga is the key. No? Hindi naman pwedeng wala. Mahirap kasi pag pinagbawalan mo, lalong baka tumakas. No? Lalong, kunwari, masasabik sila eh. So, baka pag once makita nila yung food, they would tend to eat more. Kasi tagal mo hindi kumain, then you get to eat more. So, I think, example, for coffee, 1 cup of coffee per day is okay.
And, okay, 1 cup of coffee. So, no more than 1 cup, Doc?
Yeah.
Okay. Next question, Doc. We have a question here. How do we increase our appetite? Kasi I think some of the patients, they also experience this, yung walang ganang kumain. So maybe I can ask both of your opinions on this, Miss Donna and Doctora.
Well, sige, si Ma'am Donna na lang muna.
For me, ang ginagawa namin is para ma-increase yung appetite, actually it starts with the sense of sight. Yan. So, yung pag nakikita nila na yung pagkain ay maganda sa mata, very colorful, they will eat it. Pero kung psychological na talaga wala silang ganang kumain, we usually tell our patients and give them foods na blender. i-try nila for smoothies and shakes. Hindi yung napaghalo-halo lahat ng pagkain. But for smoothies, yan, yung mga fruit shakes nila, pwedeng mag-promote ng appetite para sa kanila. Aside from that, appetizers such as mga nuts, mga kutkutin, pwede sa kanila. So, kung napansin nila na parang gusto ko ng maalat So, kumain sila ng nuts na may na garlic flavor. Okay, so na-promote yung appetite nila. So, yun yung isa. Yun yung dalawang way para ma-promote ang appetite ng mga pasyente para sa amin.
From your point of view, Doc. Ay, okay. Okay, Miss Donna, go ahead po.
Nakita ko kasi yung intermittent fasting. Yung intermittent fasting.
Yun, oo. Opo.
Okay. So, different researches, they say na effective ang intermittent fasting. Now, intermittent fasting is effective if ang tao ay, or the person practicing it is nababantayan ng isang professional. So, kung ginagawa mo yan na ikaw lang na as parang nasabi lang ng kaibigan mo and then ginagawa mo, baka effective sa'yo, it may not be effective kasi walang bumabantay na walang nagsasabi kung anong oras ka kakain, ano yung mga kakainin mong mga pagkain, what's the best for you. So our suggestion is to stop with intermittent fasting. To stop with intermittent fasting and go with a balanced diet with proper timing. Kasi ang proper timing na yan and proper snacking, kung masasanay ang katawan mo na okay, nabusog ako sa breakfast, so I may not eat AM snack anymore. So for lunch naman, kakain ako. Pag nabusog ang katawan ko ng lunch, I will not eat PM snack anymore. And same goes through with dinner. Compared sa intermittent fasting. So, di ba, meron yung 12 hours and then 8 hours, I think, na hindi ka kakain for 12 hours and then bigla kang kakain and one na parang we speculate as dietitians on that intermittent fasting is hindi sila nagbibigay ng list of foods kung anong pwedeng kainin. Meaning you could eat everything. So yun din yung isang kalaban ninyo dyan. So what if kakain ka ng tonet-toneladang ice cream at saka mga fried chicken, pizzas, and others between the time na kailangan mong kainin yun, that's also one way for you to gain weight. So maraming pumupunta sa akin, nag-intermittent fasting ako pero hindi naman ako nag-lose weight. So meaning, iba yung way niya kung paano niya gawin yung intermittent fasting. Although they recommend this especially in other countries, they recommend this for diabetes patients and then obese patients, but with the strict guidance of a doctor, a physician, or a dietitian. Kasi hindi talaga siya for everyone to follow.
Thank you, Miss Donna. Dr. Anthea, you have something to add po?
Actually, parang nasabi naman na. Siguro yung for appetite, no, I think it's important then to ask yourself, or ano ba yung gusto nyong kainin? Yes. Then start from there, di ba? Kasi kahit sabihin namin, ito kakainin nyo, hindi nyo naman gusto, mahirap din pilitin nga po ang ayaw. So, yun.
Okay. Toka, we have one more question here. Is canola oil okay for us?
For me, canola oil is okay, pero since canola oil comes from seeds, na yun ang isa sa iniwasan natin dun sa FODMAP, we may remove it. Pero yung sabi ko kanina, with the guidance of a dietitian, yan kasi may challenging process yan. Kung okay ba ang canola, kung may effect ba yan sa katawan mo, kung may gastric distress ba after consuming canola or what. So, depende pa rin yan doon sa tao. But generally, okay ang canola.
I have here a question for, I think this is for more for Dr. Anthea. So how do you differentiate chest pain caused by GERD, or how do you differentiate chest pain from GERD and from a heart problem?
Actually, pareho sila ng symptoms. That's why people, actually maraming tao, they come to the ER complaining of chest pain or heartburn, and eventually hindi naman pala sila heart attacks. So, lalo na yung iba kasi sobrang severe, para talaga silang inatake sa puso. Same crushing chest pain. And then once we go to the ER, laboratories, ECGs, we know everything is normal. So most likely it's GERD, or ang number one rule kasi in like sa ER or sa medicine is parang you try to assume the worst first. Parang lalo na sa emergency room, you assume the worst first. Rule out mo muna na hindi siya heart attack before calling the patient na, uy, GERD lang yan. Kasi mas mahirap pag na-miss natin yung heart attack than the GERD. Pero the chest pain, it's actually almost the same po talaga yung symptoms. It's medyo mahirap siyang, from a symptom lang, mahirap po siyang i-differentiate.
Okay, thank you, Doc. There's one more question here. How about seafoods? Are we okay with seafoods?
Dun sa seafoods, it's a pseudo-allergen. So may mga pasyente na sensitive doon sa seafood, meron namang hindi. Especially kung may bloating na nangyayari. Just like me, I'm not allergic to seafoods noon, pero pag nag-attack yung HSP ko, when I eat seafoods, nag-aggravate yung mga symptoms, especially bloating. So yung mga pseudo-allergens like yan, yung seafood, any types of fish, and then also tomato, yung mga gastric irritants, we limit this kung nag-aggravate ang mga symptoms natin.
Hello, can I ask a question?
Okay, go ahead, sir.
Okay. So ako rin po, I'm Architect Henry Olonan, ano po. I was I was a Scleroderma also within 4 years na yata ako, or 5 years, no. So ngayon, I heard all the explanation with regards to kung ano yung kakainin at hindi kakainin, ano. So to avoid yung madagdagan pa yung ating sakit do sa ating nararamdaman na Scleroderma. So dumarating ho sa panahon na kaya nga ho kami nandito para magkonsulta. Ito ho yung mga pagkain na kailangan i-avoid namin. Minsan may mga pagkain din naman na hindi mo kaya talagang sundan yung lahat ng mga narinig namin. So ano ho ba talaga yung pwedeng in time na kung limbawa may maramdaman kami na limbawa sakit sa tiyan, namamagana yung aming mga tuhod, namamagana yung aming mga kamay at yung mga ni namin. So ano ho ba yung pwedeng pang emergency lang na pwedeng magamot maano lang ho, temporarily relief lang ho kami. Ano hong pwede ho namin gawin? Dahil doon ho sa pagkain siyempre pagka kumakain ka, yes, ma-avoid mo. Pero dumating doon ho sa punto na gagamutin mo na yung sakit mo. Ano ho yung pwede namin, anong rinirekomenda ho ninyong gamot para at least temporarily ma-relieve ho muna kami doon sa aming problema dahil sa Scleroderma.
Sa Scleroderma po kasi, I'm sure lahat naman po kayo may mga maintenance medications. Tama po? So sir, yung sinasabi niyo po ba yun? Or yung sa, ano po ba yung sinasabi?
Ang sinasabi ko, siyempre, habang tayo ay may sakit, edi nararamdaman ho namin yung sakit. Ngayon, para mawala yung sakit, ano ho ba yung aming gagawin para mawala yung sakit? At ano hong gamot ang kailangan ho namin bilhin para yung ma-relieve ho kami doon sa sakit na nararamdaman namin. I understand that until now, wala pa hong gamot talaga sa Scleroderma. Pero mayroon naman nakakasurvive naman through, yun nga, yung mga sinasabi niyong exercise, avoid sa mga ganitong pagkain, at kailangan medyo ano lang, kunti-kunti lang ang kinakain para medyo mas ma-feel mo yung hindi ka masyadong ano yung tawag nito masobrahan. Pagka anything na sobra naman kasi nagiging cause of ano problema. Yung gamot na pwede ho namin bilhin sa 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 drugstore na makaka-relieve ho ng temporary ano ho namin, problema doon sa sakit. Halimbawa, sumakit yung tiyan namin, yung aming diarrhea. Nagda-diarrhea kami. Or biglang kinabukasan sakit ng mga buto-buto namin. Siyempre kailangan magkaroon ho kami ng relief ano ho doon, temporarily para paano naman makalakad kami o makabangon kami.
Sir, may iniinom po ba kayong maintenance for your scleroderma?
Meron ho akong iniinom yung ano ba ito? Yung
Telcep?
Mopitel. Mopitel. Isa ho yun sa mga ibinigay sa akin ng aking doktor. Pero parang feeling ko, parang sinusuppress lang niya yung pero yung sakit, hindi ho rin naman nawawala. Siyempre, meron din ho dyan mga binibili tayo yung Arcosia na pang-relief talaga. Pero minsan, yung side effect ho nun, yung dito naman sa mga natin, sa kidney. So, kung yun ay araw-arawin mong iinumin dahil araw-araw sumasakit yung mga bones mo at saka yung mga kasukasuhan mo, hindi mukhang hindi ka tatagal dahil yung Arcosia malakas, napakalakas. Pero nakaka-relieve talaga. Nakaka-relieve yung Arcosia. So dahil nga tayo nag-uusap-usap ngayon, dahil meron sinasabi mo kung may maintenance ako, meron. Pero yung other than that, meron pa ho ba tayong pwedeng other alternative medicine na pwedeng sa amin?
Ganito sir, no? Kasi po hindi ko po alam kung active po ba yung scleroderma nyo or hindi. Siyempre depende po yun dun sa rheumatologist nyo kung saan po kayo nagpapatingin. Kung tama po ba yung dose na iniinom nyo ngayon, baka po kasi kulang, kaya po kayo nakaka-experience minsan ng mga symptoms. Kasi hindi naman po pwede parang yung gusto nyo na symptomatic relief. Kailangan po natin i-address kung ano po talaga yung root cause. Hindi porket like sabi niyo nga masakit yung joints niyo, hindi talaga po pwedeng mag-arcok siya kayo araw-araw. Kasi nakakawala lang po siya ng pain pero hindi natin alam ano po yung nagko-cause ng joint pains niyo. So it might do more harm than good. So mas maganda po is you consult back with your rheumatologist. Baka po need ng dose adjustments sa mga mini-maintain yung gamot. Kaya po baka po kayo nakakaramdam pa ng mga pains or iba pang symptoms. Baka po yung disease activity or yung sa scleroderma nyo, hindi po, kumbaga hindi siya nakokontrol ng maayos sa mga gamot nyo.
So talaga, ito naman, controllable pala ito.
Ang scleroderma po, yes po, tama po kayo. Wala po talagang cure sa mga autoimmune na sakit. Pero marami na po tayong treatment options that could control the disease. So like ngayon nga, marami naman pong scleroderma patients na hindi naman lumalala. Kumbaga nakokontrol natin yung mga sakit. Then eventually, bumabalik naman yung quality of life po nila.
Okay, so when you say control po, anong mga particular kayang gamot kailangan ko bang tanungin ko sa rheumatologist yun?
Yes po, mas maganda po kasi po yung mga gamot natin sa Roma, hindi naman po yan basta-basta lang na parang bibili ka lang ng over the counter. Lahat po yan by prescription. Talagang sinusuring maigi kung ano po yung kailangan ninyo. So, hindi po, kumbaga, yung iniinom yung mycophenolate mofetil, I'm sure hindi lang naman po kayo yung umiinom noon. Madami din po, hindi lang scleroderma patients din po ang umiinom noon, maski po
Tama,
mga
pero parang sa akin nga yung micronopolit, parang hindi ko maalaman po ano ang kanyang parang purpose do sa sakit kong Scleroderma. Kasi kung may naman ako ng micronopolit, ang problema rin, andun pa rin yung sakit ng katawan ko, andun pa rin yung sakit ng lahat ng mga buto-buto ko. Parang saan ho siya nakakagaling? Yun ang tanong ko ron eh.
Mycophenolate mofetil. Okay, isa po siyang hindi siya cure, pero stop siya at least ng disease process or disease activity niyo. Hoping na makontrol po nga niya yung sakit ninyo. So, ang gusto niyo pong, kailangan niyo po kasing bumalik din sa doktor ninyo, yung sa rheumatologist po ninyo. Baka po hindi lang scleroderma ang sakit niyo. Baka po may iba pa po kayong sakit na kaya nyo po nararamdaman mga yan. Kumbaga, hindi lang scleroderma po.
Well, wala naman akong ibang sakit kasi lahat naman ng mga organs ko, lahat naman pag ako ay nagpapa-check up, lalo sa dugo, lahat naman normal from kidney, heart, and everything. So, normal ho lahat. Nakatulong pa nga raw itong myclonopolit dahil parang nabawasan imbis na tumaas, mas bumaba pa nga eh. Pero hanggang doon lang siya. Pero yung pagdating doon sa mga sakit-sakit ng mga katawan, sakit sa kung saan man bagay ng ano, yun ho yung hinahanap namin na ano ho ba yung para maging mag-normal, makalabas kami, makapunta kami kung saan, ano ho ba yung tamang pwedeng advice na gamot na pwede namin gamitin.
Wala po kasing specific na gamot para dyan, sir, no? Yung parang pain, tapos painkillers. Hindi po kasi ganun kadali magbigay ng ganun na gamot, lalo na hindi naman po kita nakikita. Sir, hindi ka namin patient. Hindi ko po sabi ano po yung sakit niyo eh.
So
mas maganda po talaga, kumonsulta kayo dun sa doktor po ninyo, and then siya na po ang syempre magbibigay, mas nakakaalam po sa sakit nyo at sa history ninyo. Mahirap naman po na magbibigay ako ngayon lang ng gamot. Tapos
wala naman. Parang tinatanong ko lang naman. Siyempre, natural, may kanya-kanya tayong profession. So, ngayon lang ho tayo talaga naman nag-usap. Pero part lang ho ito ng query ko. Para kasi doon sa rheumatologist ko, nagpa-injection na ako ng steroid. After 2 to 3 days, bumalik din uli. So tapos nag-uminom ako ng prednisone, and then after 2 to 3 days hindi rin gumaling. Saan na ho pupunta? Ano na ho yung gagawin ko para naman mahimasmasan itong problema ko?
Ayun po, yung na-injectionan po kay steroid sa tuhod, I assume.
Oh yes.
Baka po kasi
sa balikat.
Meron din.
Meron din, pero sa kamay, min-injectionan din ako. Parang hindi na ho tumatalab eh.
Marami naman pong rheumatologist, sir, no? Hindi lang naman po siguro iisa.
Pwede rin magtanong sa iba o for other opinion.
Opo. Kasi parang nagda-doubt kayo dun sa ginawa po sa inyo, pwede naman po kayong tumingin sa ibang rheumatologist.
Okay.
Wala naman pong masama. Pero baka po yung pains nyo, dahil medyo may edad na din po kayo, baka hindi na lang din po yan scleroderma. Okay, malay nyo may component ng, yun nga po, maghanap tayo ng cause, osteoarthritis, di ba? Wala po. Hindi ko po kasi kayo mabibigyan ng, ito yung dapat na bilhin. Dapat po talaga pakonsulta kayo, balik po kayo sa doktor.
Naintindihan naman namin yun. Kung nga lang nag-uusap tayo at saka ito yung chances na pwede ako magtanong ng yung tanong na pwedeng isipin ko na kung ano yung other alternative na pwedeng sabi mo nga kung
baka po exercise makatulong din sa inyo, sir.
Nag-exercise naman po. Pag nagpapaaraw ako sa umaga, nagba-bicycle, yung steady bicycle ako.
Stationary bike. Walk, magandang exercise.
lahat naman ho yan ginagawa ko dahil siyempre gusto pa naman natin madagdagan yung buhay natin eh. Kaya nga nandito ho kami purposely para marinig ho namin yung mga kanya-kanyang opinion na maaring tama ho kayo na kailangan magtanong din kami sa ibang doktor o maaring kulang yung dosage ko or kailangan dagdagan. So yun ho yung mga gusto kong tip na parang maintindihan.
Sorry sir ha. Yun na lang po. Siguro po, ako po bilang scleroderma patient for 14 years now, meron pa rin po talagang pain. Pero ako, medyo lucky ako. Hindi po ako gaanong pumayat. Tapos medyo nakaka-function pa naman ako. Although marami na rin po akong hindi nagagawa. Currently, ang iniinom ko is naka-prednisone po ako every other day. Tapos naka-mycophenolate din po ako. Tapos po everyday I try to do small exercises. Kasi po sabi nga nila, when you don't use it, you lose it. So kahit po medyo masakit yung joints ko, pinipilit kong kumilos everyday. So siguro po gano'n na lang po, pwede po kayong mag-consult sa Opo.
Isa ho kasing problema dun sa prednisone. Pagka uminom ka ng mga 10 milligram, pag check mo ng sugar mo, tumataas.
Opo, ganun po talaga. Kaya po regular po na chine-check yung ano natin. Kung ano po, siguro po nga kailangan lang po kayo ulit, yung detailed na consultation sa rheumatologist nyo. Or if you want nga po yung sinasabi ni Dr. Anthea, you can seek a second opinion from another rheumatologist. Tapos, sige po sir, i-ano ko lang po let's give way to other questions. Meron lang pong 2 short questions dito. I-ano ko lang po yung sparkling wine, is it allowed for us scleroderma patients? Siguro Miss Donna, you can answer this.
Okay, sparkling wine, usually nanggagaling yan sa mga wheat, rye, and barley pa rin, yung mga wines natin na didistill lang sila. So kung yung mga ito kasi kasali doon sa FODMAP natin, no, yung na-discuss ko kanina, if you are sensitive to it, tanggalin na lang. Pero sabi nga rin ni Doc kanina, yung mga alcohol kasi dapat tanggalin na sa diet natin. So wine of course is considered as alcohol, so as much as possible, tanggalin na rin natin sa diet natin. I wouldn't want to recommend kung ilang dosage ang pwede sa atin kasi baka i-everyday nyo naman na, sabi naman ng dietitian, pwede yung ganito, imbes na hindi tayo umiinom porque recommended. But, it's better to remove it from the diet na lang.
Okay, I think we have room for 1 or 2 more questions. On FB Live, we have one question here. One question, how can we increase body metabolism? Most patients lose weight, but there are also some patients like me who tend to gain weight and perhaps retain body water due to the prednisone. How can we deal with it?
Yung sa prednisone kasi, syempre isang side effect talaga niya yung water retention, no? Pero yung sa weight, I believe in food talaga. Food and exercise. Kasi yung iba nga, yes, they exercise regularly. But they also eat regularly na madami. So, bawi lang eh. So, losing weight, it's really hand in hand with diet and exercise. So, kailangan po din, syempre, nag-guide din kayo with diet and exercise. Kasi baka nga, yun nga, you just exercise ka nga, 1 hour ka tumatakbo or something. Pero after nun, nasa samgyup salamat ka na, kumakain ka na ng eat all you can. So wala din, di ba? So sayang lang, bawing-bawi lang. So to lose weight, kailangan kasi mag-negative eh. More yung expenditures, more yung ginagamit natin than sa kinakain. So kailangan talaga discipline. Yun yung isa yun, discipline po talaga.
Also to add, dun sa weight loss management, most dietitians, including me, believe in the rule of thumb na 75% diet and 25% exercise kung gusto niyo talagang mag-lose weight. Now, if sabi ni doktora kanina dapat negative kasi mas madami ka dapat expenditure, meaning mas marami yung exercise mo kaysa sa calories na kinakain mo. Because when you exercise, you excrete or parang nag-expend ka ng calories. So kung kumain ka in one day, kumain ka ng 1,500 calories, you need to move to to spend that 1,500 calories. And if na-spend mo yung 1,500 calories, if you go beyond that, na nag-exercise ka pa, dun magkakaroon ng weight loss. Now, kung wala kang physical activity, it's better to reduce na lang yung kinakain mo yung mga types ng food na kinakain mo and your eating habits. Especially kung ang type of exercise mo lang is walking and walking, yung mga jogging, yung mga light to moderate exercises, it wouldn't spend that much calories kasi. Compared to swimming, compared to long distance running, yung cycling na masyadong malayo, yun kasi ang mga nag-spend ng maraming calories. Kung ang physical activity mo lang kasi is yung mga light to moderate exercises, expect already na hindi ka masyadong maglulose ng weight. So kung alam mo sa sarili mo na hindi ka tinatamad ka palagi mag-exercise, bawasan mo na lang ang yung kinakain. Yun lang yun.
Okay, thank you po, Miss Donna and Dr. Anthea. I think we just have time for one more question. Meron dito question from Marin. Ano po ba ang normal weight sa mga case namin na may sclero?
It depends po, di ba, sa height pa din natin and age. I mean, mostly sa height kung anong ideal body weight po natin.
Yes.
So, hindi po siya one size fits all. Hindi, I mean, not yung ideal body weight ko will not be the same sa ibang tao po. So, it depends din po sa height nyo. Actually, may mga app yan, di ba? Sa
Dok,
Google.
ito yung ito yung BMI, di ba? Yung
Body mass.
body mass index. Okay. It's the height versus the weight.
The weight.
Okay. So I guess wala na pong questions. I think we've covered all the questions both sa FB Live po and then sa Zoom. So Dr. Anthea and Miss Donna, do you have anything else before we end this webinar?
Basta anything in moderation for me. I mean, I cannot say na bawal talaga lahat ng bawal kasi I'm sure mahirap po yun. Saka baka sabihin nyo, ang sama naman namin. Hindi na kayo enjoy. Pero yun talagang, kailangan parang discipline na
Yes.
gagawin nyo po yung parang yun nga, yung small and frequent meals, hindi kayo kakain ng madami. I think kung ma-discipline at magiging lifestyle nyo na po yung mga yun, hindi na po kayo mahihirapan. Kasi kumbaga magiging parang natural na po sa inyo yung mga yun. Yun po. Saka yun nga po, regular, maliban sa diet, kailangan po natin inumin yung mga meds natin and of course, regular follow-up po sa mga rheumatologists nyo, sa mga doctors nyo. Para, kumbaga hand in hand, hindi po pwedeng isa lang. Kailangan po talagang combination siya na, your meds, diet, and lifestyle. Kaya po natin makontrol yung disease ng Scleroderma. Okay, sa panahon po ngayon, may gamot na din. So, we just have to work together and hopefully, di ba, lahat po tayo magiging okay din.
Miss Donna, final words po.
Final words, yung parang sinabi ni Doktora kanina, no one diet is for everyone. So, walang diet na one size fits all. So, lahat po tayo may kanya-kanyang diet, depende sa pangangailangan ng katawan, depende kung sobra ito sa katawan natin o kulang ng katawan natin, yun po ang ina-address namin bilang dietitians. So, kung hindi, especially itong mga fad diets na masyado ng uso ngayon, like itong isang question dito na ketogenic, mga intermittent fasting and whatever, if it is effective to one person, hindi ibig sabihin na effective sa'yo. Okay? So I just want to ask, and I'm sorry Ma'am Weng, sagutin ko ulit yung keto diet, is it safe for Scleroderma? Keto diet is very high in fat, no? And it is low in carbohydrates. So ang sabi natin kanina, if high in fatty meals ang kinakain natin sa diet, nagkakaroon ng gastric distress, diba? So yun ang iwasan natin. So the higher the fat content doon sa diet natin, mahirap tayong mag-lose weight, mahirap pag palaging bloated ang tiyan natin because of the fat. Ganon din pag ang fat ay manggagaling sa plant sources like your vegetable oils, ganun din ang result. So as much as possible, we stick to balanced diet. In moderation, variety, and balance always. Yun ang the best para sa atin.
Okay, with that, let's finish this webinar. First, I would like to thank everybody who joined us both in Zoom and on FB Live. We'd also like to thank our presenters, Miss Donna and then Dr. Anthea. Maybe I will later ask your contact numbers if ever they will be interested to ask a consultation from you. And then thank you for special mention to my co-organizers, Dr. Leen Agbanlog, Dr. Kleng, and my co-warrior, Chi. We hope to see you all again. We plan to do this on a monthly thing. So if ever may suggestions po yung mga co-Scleroderma warriors ko dyan for any topic, message nyo lang po ako and then we'll do something about it. So most probably po end of August ulit yung next webinar natin. So again, thank you very much po for participating in today's webinar. Thank you.
Thank you.
Thank you.
Thank you po.